the effect of weather changes on psoriasis. In India, there are three different seasons, that is winter, summer and rainy season. So all these seasons do make some impact on psoriasis patients, especially the winter. It is said that psoriasis increases in winter and after winter it reduces. So the thing is that in psoriasis usually there is a dry skin, and in winter everybody's skin becomes dry. So naturally psoriasis is aggravated in winter. So one has to take care during winter, that is one has to keep his skin moisturized in winter, that is one has to apply the moisture, as well as to protect the dryness of a skin, one has to protect oneself from the cold, that is one has to keep his body warm. So that is one thing to be done by the psoriasis patient for protection from winter. Another important thing that is that in case of summer, in fact sun is very good for psoriasis patient. If a psoriasis patient exposes his body for 10 to 15 minutes every day in sun, so his vitamin D level increases, and which in turn improves his psoriasis. But one should not be greedy that one should go in sun for hours together. That can have an opposite impact. It can be very harmful, because the normal skin of the people, that is a dead skin, it protects you from harmful ultraviolet rays of sun, whereby the skin of psoriasis patient is a living skin. So the ultraviolet rays are not prevented, they directly go into the body, or they can cause the burn in the skin. They can burn the skin, that is called as a sunburn, which is a very severe condition and it can aggravate psoriasis. So psoriasis patient must protect themselves from intense sun heat, especially 11 to 4 p.m. Another important season is a rainy season. Especially rainy season, there is a lot of humidity, and when there is humidity, the dryness of skin is less. So usually this is a good season for psoriasis patients. But in a rainy season, if one goes out and gets wet, so one has to immediately dry his body. Otherwise, if he has a psoriasis, especially the plantar psoriasis, hands and feet, and he does not dry up his body, or if he has an inverse psoriasis, that is psoriasis in skin folds like axilla, groins, under the breast. So if it is wet, so definitely sweat and the warmth and the water and the dead skin can increase a fungal infection there. So one is likely to get fungal infections in rainy season. So the psoriasis patient should keep their body dry, clean in rainy season to avoid the secondary infections. Thank you.